How should I measure my medication?
That's a great question. So when you're taking a liquid medication for you or your child, you want to make sure that you understand the dose, first in milligrams and then also in mLs. Any measuring device that you have for that liquid medication should have markings in ml increments. So you would measure based on your dose in mLs in your measuring device, whether that be a spoon or oral syringe. But when you're talking about your medication with your provider or your pharmacist, you want to make sure that you know that dosage in milligrams and mLs.
And I'll just jump in and add on too that when you get a liquid medication from a pharmacist, if you don't have an oral syringe or a medication spoon, don't just use one from home. Ask the pharmacist to give you one, and they will. They usually provide one with it, but if for some reason they don't be afraid to ask for one, because you want to make sure that you're getting those measurements correct. It's not best practice to say teaspoon. You should say 5 mLs, not teaspoon, because people use those terms differently, and people could get confused with tablespoon, or they might think like a cereal spoon in your drawer is the same thing as a teaspoon when it's really not. So to get those really accurate measurements, it's important to use a medication dispensing syringe or spoon that's developed for that purpose with those clear markings. And like I said, the pharmacist will give you one if you ask.
And also, even, if it's your first time or new medication, even bringing what you plan to be measuring this liquid medication to your pharmacist, and they can help you practice and even mark that device, whatever you're using, to where your dose should be measured to.
And you can take it to your appointment with your provider as well to show, here's how much I'm giving, just to reinforce, that it is the correct amount. So, I mean, everybody's here to help. Nurses, physicians, nurse practitioners, PAs, your pharmacists, like everybody here, we're all on the team to help.